Hi everyone, I hope you all are doing absolutely fine. So this is Dr. Ankit Kaushik, and on behalf of VetGuru, I welcome you all to this Vet Science crash course. So without any further ado, let's get started. So here we are with another lecture, that is lecture number 2 of Unit 1, that is General Medicine. And in this lecture, we are going to talk about the symptoms, signs, diagnosis, prognosis, and the treatment of disease. So without any further ado, let's get started. So first of all, we are going to talk about the symptoms versus sign. So the first thing is, what do you understand by symptoms? So they are nothing, just the adverse feeling because of any abnormality of physical, mental conditions in animal like pain, discomfort, nausea, and fatigue. So basically, if your animal is experiencing any adverse feeling, any not good feeling, because of any abnormality either in the physical structure or mental condition. Okay, it can either be pain, discomfort, nausea, fatigue. It may not always be visible to the observer. So basically, if we compare symptoms with the signs are always visible, but the symptoms are those which are not always visible. It means they will not give you a conclusive evidence. Now, there are two types of the symptoms. The first one is subjective and the objective symptoms. So basically, whenever the symptoms like pain, fatigue, etc. are experienced by animal internally, and they are not applicable in the veterinary practice except for the rare behavioral cues. For example, the horse look at the flank to express the abdominal pain. So basically, the first type of the symptom is subjective. It is a type of a symptom which is not experienced by animal externally. It means it will always be internal. Okay, this is a very important point, that subjective symptoms are always internal. Okay, and they are not applicable in the veterinary practice because it is only experienced by patient internally, and in the veterinary practices the animals cannot speak. They will not tell you about what they are actually experiencing. That is why it is not applicable in the veterinary clinic practice. Okay, but there are some exceptions like rare behavioral cues in the horses. Usually they look at their flank region to express the abdominal pain, but it is also not very conclusive. The second one is objective pain. It is actually observable by the veterinarian or the caretaker. It includes behavior, physical signs, changes in the function that can be measured or seen, like lameness, labored breathing, increased heart rate, and reduced feed intake. So basically, observable symptoms are those symptoms that only be visible by veterinarian or a caretaker. Actually, I want to say a experienced person. Okay, the person who is either in the close vicinity with that particular animal or a experienced veterinarian. Okay, so when we are talking about the objective symptoms, we are actually talking about the physical signs or the changes in the function that can be seen with your naked eyes or can be measured. Okay, like what? The first one is lameness. If the animal is suffering from any sort of physical abnormality, it can be seen with your naked eyes. Labored breathing. The respiratory issues can be accompanied with labored breathing. It can be observed by a veterinarian or a caretaker. Increased heart rate, that is tachycardia. Reduced feed intake can be either noticed by a veterinarian or a caretaker easily. So, objective symptoms are observable, whereas subjective symptoms are only internally that were experienced by the animal. Okay. In the animal practice, veterinarians have to depend on the objective symptoms. Okay, this is very important. In the veterinary practice, the subjective symptoms are not at all applicable, except there are some exceptions. Okay, but only the objective symptoms are actually helpful for the veterinarian. Okay, so now let us talk about some subdivisions of the symptoms. The first one is premonitory or precursory symptoms. Here are only warning signs will be there before actual the disease manifest. Example, suspension of rumination, lack of appetite, feeling of chill before the onset of fever. So whenever we are talking about what? The premonitory or precursory symptoms, here the symptoms will only denote what? The warning. Actually, the disease is not set up yet, but only the warning signs that shows that in a coming future the disease may manifest. Okay, so only the premonitory symptoms or precursory symptoms are the warning one. Okay, examples: the rumination will be ceased, the food intake will be decreased, feeling of chills before the onset of fever. Now the second one is pathognomic lesion. What do you understand by pathognomic lesion? So basically they are very specific and help in diagnosis of a particular disease. For example, lockjaw and tetanus, crepitation of muscles in the black water. So basically pathognomic lesions are those lesions which will be very specific to a particular disease. It means they are providing you a conclusive evidence about the diagnostic approach. For example, if you're talking about lockjaw, so lockjaw is very specific to tetanus, hence it is a direct evidence that animal is suffering from tetanus and will help you in a diagnostic approach. Same goes with the crepitation in the case of the black water. Coming to the direct or idiopathic symptoms, they are the symptom that directly arises from the primary disease process. Example, mucus and blood in the tenesmus and the dysentery. So basically the direct or idiopathic symptoms are those symptoms that will arise directly from the primary disease. Okay, here the secondary disease is not at all involved. So the example here you can say, in the case of the dysentery, the fecal discharge will have mucus and blood, which is because of the primary disease process. Coming to the next, that is indirect symptoms. Here the manifestations are due to impact on the remote organs, not on the primary site. Example, vomition due to nephritis, dyspnea due to liver enlargement, right limb lameness due to right kidney disease. Okay, so basically whenever we are talking about indirect symptoms, here the manifestations are basically on the remote organ but not on the primary site involved. For example, if liver is the primary site, okay, and adjoining organs of the liver will be affected, but the prime infection was set up in the liver, but the manifestations or the symptoms will not be of the liver pathophysiology, disturbed pathophysiology. Example, the first one is vomition due to nephritis in the dogs. So basically the nephritis, it is the inflammation of nephrons, is the primary site. Okay, whatever the disturbed physiology reason was there, we are not right now dealing with it, but nephritis is the primary site of the disease. But due to this nephritis and the involvement of the primary site, there are manifestations on the remote organs leading to the vomition. Okay, hence it is indirect. Same goes with dyspnea in the case of liver enlargement. Okay, the next one is right limb lameness due to the right kidney disease. Okay, the next one is periodical or remittent symptoms. They are the symptoms that disappear and reappear intermittently. It simply means, like the simple means says that in an animal suffering from any XYZ disease, the symptoms will come and then they will go. Again, they will appear and again they will go away. Okay, so this period will go on. For example, biphasic fever in the case of canine distemper. Here the temperature of a dog will rise and then the temperature of the dog will decrease. Again, there will be a rise in temperature along with the lowering of the temperature. Coming to the typical symptoms, they are the classical expected symptoms from a disease that defines it. So basically, whatever the disease is involved and whatever the classical symptoms, like very specific symptoms to a disease, are the typical symptoms. Like muscle crepitation in the case of black water with septicemia is the typical symptom, because whenever we are talking about black water in any animal, we are actually looking for these symptoms, which are the typical defining feature of this particular disease. Coming to the atypical symptoms, they are irregular, unusual symptoms and not typically associated with the disease. Basically, for example, nervous signs in the calves with coccidiosis. So, whenever we are talking about atypical symptoms, as the name suggests, they are atypical. It simply means they do not have any association with the disease, but are actually vague. It may or may not be present with every case. For example, nervous signs in the case of the calves with coccidiosis is not a classical symptom that we are looking for. It is just what? It is just an irregular or unusual symptom. Now moving on, let us talk about signs. So what do you mean by signs? So simply they are the observable outward manifestations of a disease, always objective and measurable. So basically these are the two important things, that signs are always objective and they can be measured, and they will always be an outward manifestation. It means you can see them, you can perceive them with your naked eyes, okay, and you can measure the changes. Example, fever, you can measure the temperature. Swelling, you can visualize it with your naked eyes. Jaundice, that is discoloration and the yellowish coloration of the visible mucous membrane. Abnormal gait, whenever the animal is walking and there is a changes or abnormal changes in the walking stance or the gait, it can be measured, or it can be seen, or it can be observed. Discharge, either nasal, either ocular, either vaginal, can be seen. Okay. So now let us compare the symptoms with signs. So basically symptoms are always what? Signs are always objective, whether the symptoms are usually subjective. Okay. Like if you are talking about 100 symptoms, 99 will be subjective. There are few exceptions, but mainly, generally, the symptoms are subjective, signs are objective. Detected by symptoms, patient perception, signs, veterinarians and observer. It simply means signs can be detected by a veterinarian or an experienced observer, whereas symptoms are always internally experienced. In the case of veterinary practice, only signs are of use, whether the symptoms are very rarely used. Only in the case of some exceptions, like some behavioral changes, that may be suggestive of some disease. Examples of symptoms are pain, nausea, and in the case of the signs, they are fever, vomition, and discharge. Now let us talk about diagnosis. So basically, diagnosis is the art of recognition and determination of the nature of disease. Okay. So whenever we are actually recognizing and determining the nature of that particular disease or the causative agent that is actually causing the disease in an animal, is the diagnosis, and it is an art, because there are many techniques. It may be laboratory, it may be biochemical, or it may be just with the help of an experienced personnel. Okay, so it depends on the method you are using. That is why it is called as art. But the main motive is to recognize and determine the nature of the actual disease or the infectious agent behind it. Okay. So moving on, there are a few types of diagnosis. The first one is snapshot, where the actual diagnosis is very immediate with the first glance. It means you are just looking at the animal, and in a very few seconds or taking very less time, you are just passing your comments regarding that particular disease. Just in a very few minutes or time involved. So that is why it is snapshot. Direct diagnosis, here the structural lesions and pathognomic signs will be there. Okay. Exclusion diagnosis, where you will rule out other similar disease. Basically, if a disease is set up in an animal and you are looking for different signs or symptoms available, then you have to rule out that this particular signs may not be of this particular disease, these particular signs may not be of these particular disease. Then only we'll come to a conclusion that these signs, which are very definitive and are defining a particular disease. So whenever you are using exclusion method, you are excluding the possibilities, and then you are coming to a diagnosis. It is known as exclusion diagnosis. Tentative diagnosis is just based on the owner's history and the initial signs available. Symptomatic diagnosis is based on the symptoms only. Like we are looking at the symptoms, we are perceiving them, and then we are passing comments on the diagnosis. Confirmatory diagnosis, where we are going for laboratory test, ELISA, PCR, culture, biochemical profiling, etc. The confirmation is only possible with these particular tests that I named here, or many more, but the laboratory involvement will be there. Differential diagnosis, here it have to compare with the similar disease, looking for the differentiating feature. Because many times in an animal, if there is a setup of an infection and animal is suffering from a disease, there may be many signs or symptoms that may be suggestive of number of disease. But you have to come up with something that will differentiate all the diseases and the symptom signs accordingly, and then ruling out the diseases based on the available symptoms and the signs, and then coming to a conclusive definitive diagnosis. So whenever you are differentiating the signs which are similar, then you are actually talking and dealing with the differential diagnosis. Okay, now let us talk about a diagnostic test evaluation. So whatever the diagnostic test you are running to actually judge or to find out the actual disease in an animal have to pass through a certain evaluation test that will certify the credibility of that particular diagnostic test. Is, is that particular test even trustable or not? So the first one is sensitivity. So whenever we are talking about sensitivity of a diagnostic test, basically it is the ability of a test to correct identify the true positives animals with the disease. When the diagnostic test is very high sensitive, it is giving you a low false negative rate. It is used for screening diseases to catch all the cases. So basically, if a diagnostic test is very sensitive, actually here you are talking about the true positives. Like for example, if you have screened 100 animals for a particular disease X, for example, so like how many actual diseased animal are in a true sense positive for that particular disease? That will be the sensitivity of a diagnostic test. So whenever a diagnostic test are very highly sensitive, it means it is giving you a actual true results, and the false negatives, like the false negatives are those animals where the disease is not there but still the test is showing the positive result, will be very low, and it is usually used in the case of screening of the diseases. Coming to the specificity, it is the ability to correctly identify the true negatives animals without diseases. High specificity will give you the low false positive rate, and it is used in confirming of the disease. So basically, specificity is what? Specificity will tell you that whatever the diagnostic test you are running is actually giving you how many true negatives. True negatives are those animals where there will be no disease. I know it is quite confusing. Let me take an example. If a particular animal group, like for example 100 animal group, is actually screened for some particular disease using any diagnostic test. So whenever we are talking about specificity of that particular diagnostic test, it is actually the ability of a test to identify true negatives. It means true negatives are those where the animals are not diseased. Okay. And if there are good high specificity of that particular diagnostic test, it is actually giving you the low false positive rate. Low false positives are those basically false positive. It means the animals is not suffering from disease, but still the diagnostic test is giving you the positive results. Whenever we are talking about sensitivity, we are talking about screening. And when we are talking about specificity, we are talking about confirmation of the disease presence. Coming to the positive predictive value, the proportion of animals that test positive and are actually have the disease influenced by the disease prevalence and high positive predictive value. It means positive tests are likely to be true. So basically, positive predictive value will tell you that whatever the diagnostic test you run in a number of animals or a group of animal is actually true positive and actually having the disease. Like for example, if you are screening animal for disease D, so actually whenever positive predictive value is calculated, it is actually telling you in that particular group of animals suffering from suspected disease D will be actually positive for the disease entity. It is usually dealing with the prevalence of the disease. So whenever the test is giving you high positive predictive value, the test results are likely to be very true. Coming to the negative predictive value, here the proportion of animals that test negative are truly disease free. High NPV will give you the negative results likely to be true. So basically, it is just opposite the positive predictive value, that is actually giving you the proportion of the true negatives. It means the animals that are not suffering from disease among the diagnostic control group. Okay, for example, if you have 100 animals and you have screened these animals for disease D, so it is not necessary like all 100 animals will be diseased or positive for that entity. So basically, negative predictive value of a diagnostic test is telling you like whatever the animals that are screened, and among them whatever the animals are true negative, it means they are not disease free. Here is the proportion. So if a diagnostic test having a very high NPV, it is telling you that the negative results is likely true. It means the animals that are screened in a group of animals for not having disease entity is actually a conclusive evidence. Okay. The likelihood ratio are of two types, the positive one and the negative one. So in the positive LR, show it will tell you how much more likely a positive test result is disease versus the healthy animals. It means high LR is a strong evidence for a disease. So basically, whenever a diagnostic test is being screened for likelihood ratio, and in the case of the positive likelihood ratio, we are actually talking about more positive test result in diseased versus the healthy animal. It means like how many animals are actually positive among a group versus the healthy animal. It means if a diagnostic test is having high LR positive, it means there are strong evidence of a presence of a particular disease. In the case of the negative LR, it is telling you how much more likely a negative test is in the healthy versus diseased animal. It means low LR negative means that that particular diagnostic test is showing the result where it is giving you the evidence against the presence of a disease. Okay, it means disease is not present. Okay, so these are the particular evaluation test of different diagnostic tests available that have to be run to actually come to this particular decision that whatever the animal number of animals are screened for whatever the disease entity are actually giving you a conclusive results or not. Okay, so moving on, let us talk about prognosis. So what do you understand by prognosis? You may have heard this term very often in your clinical sheets or in your clinics, in your OPDs. So basically, whenever we are predicting or forecasting the probable course and the outcome of a disease. So I hope the concept of this particular prognosis is very clear. It is nothing just predicting the future that what will happen if that particular disease is set up in animal. So we are going to now discuss about the grading of this prognosis, because the prognosis is divided into certain grades depending on the severity of the outcome. So if it is favorable, it simply means that the particular diseased animal is having a very high possibility that animal will recover. The doubtful, as the name suggests, the possibility of recovery is not very sure, not very certain. The poor simply means the possibility of recovery is not that good. And in the grave situation, the condition is very severe and the animal will possibly die. Now let us talk about treatment. What do you understand by treatment? So simply all the measures that we are using to combat the disease or its complication are what? They are treatment. Okay. So basically whatever we are doing in order to save animal, combat disease and the complication of any primary disease during its course is known as treatment. It is having a different types. The first one is physical, where the heat, electricity, X-ray, UV rays, infrared are being used. Like in the case of musculoskeletal disease or disorder, like muscular pain or anything. Okay, the heliotherapy deals with what? Use of sunlight. In the case of rickets, because vitamin D deficiency have to be combated with the help of sunlight. hypopigmentation, psoriasis, and eczema. Symptomatic treatment is basically when the treatment is on the basis of symptoms only, but not dealing with the cause, like use of astringents in the case of what? Gastroenteritis. Palliative treatment deals with only life prolongation. Basically, here the animal is suffering from any incurable disease. Like the incurable disease are something which cannot be cured with any possible treatment. So here all the measures will be taken in order to prolong the life. Like what? Use of insulin in the case of diabetes mellitus. Rational therapy means it is based on what? Pathophysiology of the animal and pharmacology involved, like use of atropine in the case of spasmodic colic in the case of horse. So basically, it is a rational therapy where the pharmacology of the drug and pathophysiology of the animal both are studied, and then the treatment is prescribed. Empirical treatment is based on the experience of the veterinarian or sometimes hit and trial method. Basically, when many times the disease condition in an animal may not be diagnosed very well. This is a limitation of the veterinary practice, as we always worry about this thing. That the actual diagnosis is very important, but in many case scenario it is not possible. So, for in that case scenario, we will go for our experience or either the hit and trial method. Basically, we will prescribe a drug. If that drug is actually curing the disease and giving you the positive results, we will continue it, and if it is not, we will just withdraw the drug. Okay. The specific treatment here, the definitive therapy for the diagnosed disease are being used. Basically, the diagnosis of the disease is very specific, and now the specific drug will be prescribed. Prophylactic treatment is just for the preventive measures where this disease spread is to be countermeasured. It means, like in a group of an animal, we are suspecting that any particular disease in any particular time period of a year can be spread. So we will take all those measures that will prevent the spread. Like in the case of dog, we are usually vaccinating them with anti-rabies. In the case of a livestock animal, we are usually going for FMD vaccines, blackwater HS vaccines, isn't it? Okay. As well as some nutritional and vitamin supplementation are also used in order to enhance the immunity of the animal that will prevent the further disease spread. So that's all for this particular lecture where we have talked about so many things, including what? Tell me the symptoms, the signs, the diagnosis of the disease, along with the prognosis, and finally the treatment of disease. So I hope the things are very clear. That's all for this lecture. Thank you very much. Stay tuned for the next one.